We have already told you about type 1 or juvenile diabetes. Now, let's discuss more about type 2 diabetes, which is the most common form of the disease, affecting almost 90% of diabetes patients. Type 2 diabetes means that the body is unable to use insulin properly. That is why it is also known as insulin-resistant diabetes. In the beginning, the pancreas might try and overwork to make extra insulin, but over time, what happens is that the pancreas are unable to make enough insulin to keep the blood sugar levels normal. The sugar then starts building up in the blood instead, which leads to high blood sugar levels. So, it is different from type 1 diabetes, in which there is an absolute lack of insulin because of the damage to the islet cells in the pancreas which produce insulin. What causes type 2 diabetes? There are a lot of reasons that could contribute to a person getting diagnosed with diabetes. More often than not, it happens due to a combination of factors. Obesity and genetics are said to be the strongest contenders for that. Is there a way to prevent type 2 diabetes? Well, there are some factors like genetics, ethnicity, and age which cannot be controlled. Leading a healthy life, keeping a tab on the diet and exercising properly to stay fit can definitely delay the onset of the disease, if not prevent it. How is type 2 diabetes managed or treated? Type 1 diabetes can only be managed with external insulin, but the management and treatment of type 2 diabetes is a bit different. In the initial stage of diabetes, the disease can be managed by exercising as well as changes to the diet. The blood sugar levels can be monitored to keep it in check. If the lifestyle changes are still not able to keep the blood sugar levels under check, then the next step would involve the use of medications. Since it is a progressive disease, eventually one may have to depend on insulin injections to help manage type 2 diabetes. Weight loss surgery might also be recommended in extremely obese people as a measure to treat diabetes. How is type 2 diabetes diagnosed? The diagnosis for type 1 and type 2 are common in terms of the sugar levels in the blood. The tests are also the same. The only difference is that type 2 diabetes is characterized by high blood glucose in the context of insulin resistance and relative insulin deficiency, while type 1 is when there is an absolute insulin deficiency as it is not produced by the cells which are supposed to. How does type 2 diabetes affect the body? Apart from the symptoms as well as high blood sugar levels, type 2 diabetes comes with a lot more problems for the body. Typically, type 2 diabetes is associated with a 10-year shorter life expectancy. It also leads to a lot of long-term complications that arise from it. That is why no one really dies of diabetes. They die of the ailments that it brings along with it. So that's a lot in detail about type 2 diabetes. Now, let's get into the details about type 3 or gestational diabetes.